what I'd first like to do is ask if anyone else on this stage agrees that the Massachusetts example was a great opportunity for the rest of the country.
No.
No. It was a great opportunity for us as a people to see what will not work, and that is an individual mandate in this country.
What we faced in our state is different than what other states faced. What we had is a lot of people who found that they could simply stop getting insurance, go to the hospital, and get free care paid for by other people, paid for by taxpayers. We were spending hundreds of millions of dollars in our state giving care to people who in some cases could afford to take care of themselves. And we said, you know what? You've either got to get insurance if you can afford it, or you're going to have to help pay the cost of providing that care to you. And that was the approach that we took. It's a model that lets other states still take a look at it. Some parts of it have been copied by the states, some haven't. One thing I know, and that is that what President Obama put in place is not going to work. It's massively expensive. In our state, our plan covered 8% of the people, the uninsured.
Governor Perry, you clearly don't like the Massachusetts plan as an example for other states, but Massachusetts has nearly universal health insurance. It's first in the country. In Texas, about a quarter of the people don't have health insurance. That's 50 out of 50, dead last. And, sir, it's pretty hard to defend dead last.
Well, I'll tell you what the people of the state of Texas don't want. They don't want a health care plan like what Governor Romney put in place in Massachusetts. What they would like to see is the federal government get out of their business. For Medicaid, for instance. As a matter of fact, I bet Mitt and John would both agree, and I know Newt would as well. Medicaid needs to be block granted back to the states so that we can use the innovation in the states, come up with the best ways to deliver health care. My wife is a nurse, and I'll promise you, we understand that if we can get the federal government out of our business in the states when it comes to health care, we'll come up with ways to deliver more health care to more people cheaper than what the federal government is mandating today with their strings attached. Here's how you do it. One-size-fits-all effort out of Washington, D.C. That's got to stop. And I'll promise you, on day one, as the President of the United States, that executive order will be signed and Obamacare will be wiped out as much as it can be.
Governor, quick follow. Why are so many people in Texas uninsured?
Well, the bottom line is that we would not have that many people uninsured in the state of Texas if you didn't have the federal government. We've had requests in for years at the Health and Human Services agencies to have that type of flexibility, where we could have menus, where we could have co-pays, and the federal government refuses to give us that flexibility. We know for a fact that given that freedom, the states can do a better job of delivering health care, and you see substantially more people, not just in Texas, but all across the country, have access to better health care.
John?
Thank you.
John?
Just 1 minute. I'd like to go to Governor Huntsman, if I could, because at the heart of this is this argument about the individual mandate. Is it ever appropriate for government at any level, federal or state, to force people to buy health insurance?
Absolutely not. You know, at some point, we're going to get around to talking about individual and personal responsibility. But I've got another solution for you with these two great governors over there, both of whom I like and admire. And I hate to tell you that the situation in Utah is pretty darn good, but I want to draw you to another example there. We embarked upon health care reform. We did better than Rick in terms of covering the uninsured, and we don't have a mandate. It allows the free market to create a marketplace of choices and options for people.
With all due respect to the governors, issuing an executive order will not overturn this massive law. This will take a very strong, bold leader in the presidency who will lead that effort. No, none of us should ever have ourselves think that the repeal bill will just come to our desk. It will take a very strong leader. I was the first member of Congress to introduce the bill to actually repeal Obamacare. As the nominee of the Republican Party, it will be my business to make sure that I elect also 13 more Republican senators who will help me repeal Obamacare. This is the issue of 2012, together with jobs. This is our window of opportunity.
The fact is, every person up here understands Obamacare is a disaster. It is a disaster procedurally. It was rammed through after they lost Teddy Kennedy's seat in Massachusetts. It was written badly. It was never reconciled. It can't be implemented. It is killing this economy. And if this president had any concern for working Americans, he'd walk in Thursday night and ask us to repeal it because it's a monstrosity. Every person up here agrees with that.
Right.
Here's what I would do. Let's pass patient-centered, market-driven reforms. Loser pay laws. Some people call it tort reform. loser pay laws. Let's expand medical savings accounts versus what the president did in Obamacare. He shrunk health savings accounts. Let's allow association health plans.
But I was trying to get your attention a little while ago. There's 8 of us up here. I'm a physician, but you sure weren't going to ask me any medical questions. But I would like to address that just a little bit. First off, you know, the governor of Texas criticized the governor of Massachusetts for Romneycare, but he wrote a really fancy letter supporting Hillary Care. So we probably ought to ask him about that. But mandates, that's what the whole society is about. That's what we do all the time. That's what government does. Mandate, mandate, mandate. And what we talk so much about the Obama mandate, which is very important. But what about Medicare? Isn't that a mandate?